So, students, we are into the ninth part of the elbow complex. Now, we have reached to start. I have started the muscle action regarding the muscle action of the elbow, and important points are summarized here. And except some of the points, most of the factors affecting muscle activity or muscle action is same for all other joints also, such as the number of joints crossed by the muscle, the PCSA, that is a physiological or physiologic cross section area, location in relation to joint, magnitude of the applied load, types of muscle action, speed of motion, momentum at different joint positions, and fiber types. I'm just telling you this because if you study this, these are common points which are applicable throughout our major joints. So these points are very important so that you can apply this. The other only exceptional for elbow joint is the position of the elbow and the adjacent joints, position of the forearm. So now we are coming to the muscle action of the elbow joint with all the above the earlier points in mind. We can say that information regarding muscle action comes from studies using electromyography. So EMG is a very important study, which is a technique used to monitor the electrical activity that is produced by the firing of motor units. So we can understand that the contraction, it's a method of understanding the contraction of a muscle, whether the contraction is happening or what is the amount of contraction. It can be it can be measured by using the graph, which will represent the magnitude of the electrical activity, which in turn represents the firing of the motor units. EMG studies can determine the relative proportion of motor units that are firing in a particular muscle during a specific muscle contraction. So if you are using, there are various methods of EMG reading, but if you are using a very accurate method, or what we call as the needle, penetrating needle can also be used. So particular area of a specific muscle fiber can be measured. So this is a very what you call effective method of identifying any muscular weakness or any hyperactivity or any inactivity. In addition, the muscle activation patterns of agonists and antagonists, as well as synergistic activity among both agonists and antagonists, can be identified during the performance of different tasks. These names, which are like agonists and antagonists and synergist or fixator, you all know that these are the names we give to same muscle can have all these names. It depends upon the role played by the muscle during a particular action, or what we call as a different task. So according to the different tasks which a person has to do, this particular any particular muscle can play the role of agonist or antagonist or a fixator or a synergist. So this role, we cannot just from observing from outside we cannot understand. So EMG plays a major role in identifying that which muscle in which angle, what action is, whether it is an agonist or antagonist, that has been studied or measured by using EMG studies. Now coming to, as we are discuss, we are in the elbow joint, so we are going to discuss the muscles which are elbow flexors and elbow extensor. Now we are going to the elbow flexors. The brachialis, we in the elbow flexors, we all know that the three major muscles are there: brachialis, biceps brachii, and the brachioradialis. So three muscles have to be, the biomechanics have to be understood. The brachialis is considered to be a mobility muscle because its insertion is close to elbow axis. It has a large strength potential in that it has a large PCSA, that is physiologic cross-sectional area. and the large working capacity. Whenever there is a large PCSA, it has to, that means that the bulk of the muscle is larger, means it has a capacity to work more. Its MA is greatest, that is momentum is greatest at slightly more than 100 degrees of elbow flexion. That is, it is between the 90. So most of the muscles have a similar activity like about 90 to 100 degree, or that is a perpendicular distance increases, and torque is most in this range. Because the brachialis is inserted on the ulna, it is unaffected by the changes in the forearm position brought about by rotation of the radius. You know that in supination and pronation, that is another type of motion which happens in the superior and inferior radial ulnar joint. Both of this here we in the pronation and supination. In pronation, uh, because supination is in anatomical position, normally we are in supination. During pronation, the radius is the bone which is rotating over the ulna. So here we are, what I'm trying to tell you is that the brachialis, as it is inserted to the ulna, does not have a problem with whether it's the position is into supination or into pronation. According to the EMG studies, the brachialis muscle works in flexion of the elbow in all positions of the forearm with and without resistance. It also is active in all types of contractions. So it is active in all type of contractions: isometric, concentric, and eccentric during slow and fast motions. So in all these type of three types of contraction you're mentioning, concentric, eccentric, and isometric. So all in these three, the brachialis works in the similar manner during both. Even though the speed also differs, it works in the same manner. Here we there's a picture showing how the momentum is affecting. Here it is actually, this is a biceps brachii which has been shown, but it is almost similar to that of the brachialis. It does not have such a long attachment. So just a figure to show you that when there is 20-degree flexion, the distance between the axis, perpendicular distance with axis, and the action line of the muscle is comparatively lesser. You can see here it is more shorter, higher, because when it comes to the distance increases. So when the distance increases, the momentum increases. That means the torque is maximum in this particular range of motion. The momentum of the biceps brachii, like the brachialis, is also considered to be a mobility muscle because of its insertion close to the elbow axis, joint axis. The long head of the biceps brachii has the largest volume among the flexors, but the muscle has a relatively small PCSA. The long head is a very strong muscle compared to the cross-sectional area of the brachialis. The long head does not have that much of a cross section, but even still it is a good bulky muscle. The momentum of the biceps is largest between 80 and 100 degrees of elbow flexion, already as already discussed for brachialis, and therefore the biceps is capable of producing its greatest torque in this range. The momentum of the biceps is rather small when the elbow is in full extension, and most of the muscle force is translatory and toward joint compression. So this is when the elbow is in full extension, it does not have that much of what you call as a momentum, and most of so here in this position, the rather than being a flexor, here mostly it produces a translatory or a kind of a joint compressing force in this 20-degree or 30-degree of elbow flexion. Therefore, when the elbow is fully extended, the biceps is less effective as an elbow flexor than when the elbow. So we can call that the biceps is can be called as a elbow flexor when it is in 90 degrees of flexion, because when in 20 or 30 degree of flexion, biceps does not have a contracting power as compared to the brachialis or the brachioradialis. The functioning of the biceps is affected by the position of the shoulder, in as much as both the heads of the muscle cross both the shoulder and the elbow. So both the heads of uh, we are talking about whether the shoulder has the biceps has a role, whether depending upon the position of shoulder. Yes, because it is a two joint muscle. Biceps is a two joint muscle, so position of shoulder will affect the function of biomechanics of biceps brachii on elbow. If full flexion of the elbow is attempted with shoulder in full flexion, especially when the forearm is supinated, the muscle's ability to generate torque is diminished. Activation of biceps was found to be significantly affected by elbow joint angle during concentric and isometric contractions, but not during isometric or isokinetic contraction. So the what the studies have proven is that the elbow joint is affected by biceps only during concentric and isometric contraction. But during isometric or isokinetic contraction, biceps does not have a major role to play in the elbow joint angle. In an EMG study of the flexors and extensors, the biceps brachii was active for supination torques. So in flexion extension, the biceps brachii was so here we have to understand that biceps otherwise is also called as a supinator muscle also. So here the EMG studies have proven that biceps brachii is also active on supination torques. A study by Naito and associates were asked to in subjects the subjects in the study were by Naito and associates were asked to maintain the elbow in flexion while performing alternating motions of supination and pronation at slow and fast speeds. EMG activity increased in biceps during slow supination and decreased during pronation. So here they were asked the elbow was flexed, maintained in flex. People were asked to just subjects means so the people who are participants of the study were asked to maintain their elbow in flexion. Then they were asked to perform elbow with some resistance naturally, and they were asked to perform supination pronation, and EMG leads were placed on the biceps, and they found out that EMG torque, EMG electrical activity increased during supination than in pronation. So what do you understand? It is active in supinator. The biceps brachii muscle is active during unresisted elbow flexion with the forearm supinated and forearm in midway between supination and pronation in both concentric and eccentric contraction. We can say that the biceps brachii muscle midway, that is between supination and pronation, that is what mid prone, we can call that position a mid prone. The biceps brachii muscle was active both in concentric as well as eccentric contraction, but it tends not to be active when the forearm is pronated. Mostly whenever the forearm is pronated and we try some kind of elbow flexor activity with the resistance, so or without resistance, both in both scenario, the pronation decreases the role of biceps role played by biceps in flexion. And whenever you supinate, that is natural. So the earlier studies proven that it is a better supinator. So during supination, the forearm is in supination, the biceps are the we have to understand that biceps acts more when as an elbow flexor, while in supination rather than in pronation in a both type of contraction, that is concentric and eccentric. So you all know that concentric contraction means the attachment or the insertion comes to the origin, that is contraction. But here whenever the muscle is shortened, that is called as concentric contraction, otherwise the insertion coming closer to the origin. But the muscle can contract by lengthening, that is insertion moving away from the origin, that is called as eccentric contraction. Both type of contraction, supination, while in supination the biceps brachii is a better contractor or better stronger. However, when the magnitude of resistance increases much beyond limb weight, the biceps is active in all position of forearm. So whenever the weight increases beyond